All right, good morning. Well, I'm sorry I can't be there in person. The Joint Advisory Committee is one of my favorite groups to work with. I look forward to your great ideas and conversation. Today, several of us from the Division of Behavioral Health are in Omaha, and we are participating in an immersion training on Project ECHO. And ECHO stands for the Extension of Community Health Outcomes. So it's really a form of telehealth that connects people that are experts, like at UNMC or some other academic institution, with providers or prescribers that are across Nebraska. The opportunity we have is to really learn about Project ECHO, which started in New Mexico, and see what it might be able to do to help serve our rural and frontier areas. In New Mexico, they started Project ECHO related to hepatitis C care. So they really wanted physicians and public health individuals to truly understand best practices for hepatitis C. And so Project ECHO began. And here in Nebraska, we're looking to see what kind of capacity we can build across the state related to substance use, medication-assisted treatment, and other behavioral health topics. So I hope to have a report for you at our next meeting, and again, sorry I can't be there with you. I am going to provide you some information, like I usually do, on some of the highlights that are happening in our division. So first of all, thank you all for your help with our strategic plan. We now have a strategic plan in place and a work plan that will help us move our goals and objectives forward 2017 to 2020. When we look back in 2020, we want to see things look different in our system, and so we will be measuring progress as we go along. I want you to think of our strategic plan really as the roadmap. So when we meet each time, you will be advising us on, number one, how we're doing with progress, how we can go about moving our goals and objectives forward, and then keeping us on track as we look to see the change that's made in our system. So I really look forward to our continued work over the next few years. In regards to the budget, you've probably heard a lot about the budget proposal and appropriation recommendations and those kinds of things. The last day of the legislature is anticipated to be next Tuesday. So there's budget discussions going on as we speak. So I just want you to know that behavioral health, I feel pretty fortunate that there wasn't really any surprises for us, at least so far with a week to go. The modifications or reductions that we had talked about with folks are moving forward for the most part. One exception to that, the last iteration of those recommendations did not have the reduction to our behavioral health regions. So again, a week to go, so we will see what happens there. We also have been fortunate that our items that we've asked for in terms of additional spend, that those are also still moving forward at this point. So again, more to come, and we'll keep you posted in regards to budget or budget challenges. Some good news this last week with our children's system of care. We had another press conference with the governor to roll out youth crisis response across the state. That has been very positively received. Don't know if any of you saw in the Omaha World Herald over the weekend, there was a very positive editorial about the hope that the crisis response really brings to Nebraska so that we can get out in front of youth and family challenges, get them the assistance that they need earlier. So thank you to all of you who have a role in serving our youth and families, and we'll keep you posted on this new service. Regional Center. I always talk about our Regional Center wait list, and yes, we still have one. Our teams are working diligently and very hard to really reduce that wait. We have started a Lean Six Sigma process, which is a process improvement opportunity that our staff have taken very seriously. When we look at our court wait lists, we had a process that included over 75 little steps in order to get a person into our system, served and out. And so our team has looked at, well, do we need to do each of those steps? Could we do those steps differently? And so we are down to 33 steps. So we are in the process of piloting with this new reduction of processes and things that we think will help keep that bed flow going. We will look at, we started officially, I got to stop and think, May 1st. In regards to those new processes, and so we'll keep you posted in regards to the reduction of the wait list. Also at Norfolk Regional Center, I've mentioned before that we had a leadership change with our facility operating officer, and we are getting so close to being able to announce the next facility operating officer. So look for that announcement coming in the next weeks. Linda Whitmus will be providing you a handout in regards to legislation and the progress that we made this session. I think one of our biggest wins, if you will, is with LB 417, which officially provides us the opportunity in statute to say that the Division of Behavioral Health can move forward with setting peer support standards and regulation. So we're super excited, especially now that Medicaid is going to be reimbursing for peer support in the future. We continue to work diligently with them. We're also working with other states that are looking at peer support models that are integrated. In other words, how to really have peer support serve both individuals with mental illness as well as substance use disorders. And as you know, in Nebraska, we're trying to also have them really cover the umbrella so that we have under that umbrella adults that we serve, families that we serve, and transition age individuals that we serve under peer support. We're really trying to raise that bar on the credential so that we move forward from more of a training and test model that we have now to a true credential that will be have a board and hopefully reside in the Division of Public Health in time as we work that process and really have those folks be recognized as a credential and professionalize that, if you will. So we're super excited about our partnership and work moving forward. Lastly, I know your agenda is full today, and again, we really need each of your perspectives. You all bring great ideas and questions. Our block grant priorities are part of your discussion today, and I want you to keep in mind that strategic plan that we now have with goals and objectives. We would like to really align our block grant work with our strategic plan so we can be most impactful with those federal funds. So I'm going to ask that you kind of keep those goals and objectives in mind as they're talking about the block grant, and you will be helping us set those priorities. Additionally, Cynthia is going to be talking to you about our behavioral health conference. We had another successful annual behavioral health conference. Our contract with the vendor, which was NADAC, will be ending, and so we need to look to the future of what is it that we need in terms of that next iteration. Do we need to keep things? What do we need to change? And so again, really looking to you to advise us on what should that behavioral health conference look like moving forward. And lastly, really wanted to talk about our emergency system. And many of you, in your real life that you have, right, that you carry on jobs that touch on behavioral health and the emergency system, I think it's really important that you advise us on some of those opportunities in our strategic plan to serve folks, when they're in crisis. That's when they need us most. And how do we make that as smooth as possible? And how do we also help individuals understand the services that we already have have so that we don't have challenges in terms of wait list. So Michaela will be talking with you and asking about your advice on moving that emergency system forward as well. So again, I'm sorry to provide you an update this way, but I'm super excited for your day. I hope you have a great day, and I look forward to seeing you at the next meeting. So thanks again for your service.